In this presentation, we will be focusing on recognizing and responding to child abuse and neglect. This is one of the most serious responsibilities you carry as an early childhood professional. Recognizing the signs of child abuse and neglect and knowing exactly what to do when you suspect it. Child care teachers spend hours each day with young children, often more waking hours than anyone else in a child's life. That puts you in a unique position to notice when something is wrong, and Texas law counts on you to act. Over the next several slides, we will define the 4 types of maltreatment, look at what the most recent national data tells us, walk through the warning signs in children and in caregivers, talk about abusive head trauma in infants, and cover prevention and trauma-sensitive caregiving. We will close with your legal duty to report here in Texas and the exact steps to follow. This is heavy material, and that is appropriate because the stakes are a child's safety. Let's start with a working definition. The Center for Disease Control and Prevention defines child abuse and neglect as any act or failure to act by a parent, caregiver, or another person in a custodial role, such as a coach or a teacher, that results in harm, the potential for harm, or the threat of harm to a child under the age of 18. There are 4 common types: physical abuse, sexual abuse, emotional or psychological abuse, and neglect. We will define each one in a moment. 2 ideas are worth holding on to from the start. First, abuse and neglect happen in every kind of community and at every income level. There is no single profile of a family or a perpetrator. Second, a child can suffer more than one type of maltreatment at the same time, which is why the data percentages you will see add up to more than 100%. These definitions come straight from Texas, where the Family Code in Section 261.101 governs what counts as abuse and neglect and who must report it. Let's walk through them. Physical abuse is physical injury that results in substantial harm to the child or the genuine threat of substantial harm. That includes punching, beating, shaking, kicking, biting, throwing, burning, and choking. Notice the key phrase in Texas law. An injury is considered abuse, regardless of whether the caretaker intended to hurt the child. Intent does not excuse harm. Sexual abuse includes any sexual conduct with a child, from fondling and penetration to exposure, and it includes exploiting a child through pornography or prostitution. A child cannot consent to sexual activity under any circumstances. Emotional abuse, also called psychological maltreatment, is mental or emotional injury that produces an observable, material impairment in a child's growth, development, or psychological functioning. Think habitual scapegoating, belittling, terrorizing, or rejecting a child, or extreme punishment, like confining a child in a dark closet. Neglect is the failure to provide for a child's basic needs that are necessary to sustain the child's life or health. That covers food, shelter, clothing, supervision, education, medical and dental care, and emotional needs like affection and attention. Texas law notes that neglect excludes failure caused primarily by a family's financial inability unless relief services have been offered and refused. Neglect is by far the most common form of maltreatment, and we'll see that in the numbers next. Numbers help us understand scale, but every figure here represents a real child. The CDC estimates that at least 1 in 7 children in the United States experienced abuse or neglect in the past year. And that figure is almost certainly low because so many cases are never reported. The most recent federal count comes from the Child Maltreatment 2023 report released in January 2025. For the federal fiscal year 2023, child welfare agencies received about 4.4 million referrals. After screening and investigation, an estimated 546,159 children were confirmed as victims, a rate of 7.4 victims for every 1,000 children. That number has actually been trending down over the past few years. When we look at type, neglect dominates. About 3/4 of confirmed victims, roughly 76%, experience neglect. Around 16% experience physical abuse, 10% sexual abuse, and 6% psychological abuse. These add up to more than 100% because a child can be a victim of more than one type. Age matters enormously. Infants under 1 year old have the highest rate of victimization of any age group, and about 1 in 4 victims were 2 years old or younger. This is exactly the population you serve in infant and toddler care, which is why your attentiveness matters so much. As for who harms children, about 76% of perpetrators were a parent of the victim. And the most tragic statistic, an estimated 2,000 children died from abuse and neglect in fiscal year 2023, which is roughly 5 children every single day. About half of those children were under the age of 1. Hold that in mind as we talk about infants and abusive head trauma shortly. Let's pause the lecture and watch a short video from the CDC. It is about 2 minutes long. As you watch, listen for 3 things. How common child abuse and neglect really are, which children are at greater risk, and the CDC's central message that this is a preventable public health problem, not just an individual family failure. After the video, we will turn to recognizing the warning signs. Recognizing abuse is rarely about one dramatic moment. More often, it is a pattern that you notice over time because you see the child every day. Let's go type by type. For physical abuse, watch for unexplained bruises, welts, burns, or fractures, especially when the explanation does not match the injury. Be alert to patterned marks that look like a hand, a belt, or a cigarette, and to injuries in places that do not normally get hurt in ordinary play, such as the back, the upper thighs, or the genitals. A telling sign is bruising that reappears in the same spots after a weekend or a vacation away from your care. For sexual abuse, physical signs include pain or difficulty sitting or walking, torn or bloody underclothing, and pain, itching, or bleeding in the genital area. Behavioral signs can include sexual knowledge or play that is well beyond what is typical for the child's age. The Thomas example in your Essentials textbook is a good illustration. A quiet child who paints in all black and brown and, when asked, describes a daddy spanking a little boy with a belt. The teacher did exactly the right thing. She stayed calm, did not interrogate the child, and planned to document and report. Emotional abuse and neglect often leave no marks at all, so behavior may be your only clue. With emotional abuse, look for severe speech delays, extreme habits like rocking or biting, aggression, or a child who seems blank and unresponsive. With neglect, look for constant hunger, poor hygiene, clothing that is wrong for the weather, unmet medical needs, and a child who tells you they were left alone, even overnight. When in doubt, you do not have to be certain. A reasonable suspicion is enough. The child is not your only source of information. The way a parent or caregiver responds can also raise concern. Watch for conflicting explanations that change each time you ask, or a caregiver who blames the child or a sibling for the injury. Notice fear or disproportionate anger when you simply ask how something happened. And notice delays in seeking medical care or a pattern of switching doctors and hospitals so that no one provider sees the full picture. Other warning signs include unrealistic expectation for the child's age, repeatedly describing the child as bad or worse than other children, dressing a child in clothing that hides the body, even in hot weather, and visible signs of substance use. None of these alone proves abuse, and you are not in the business of proving it. You are in the business of noticing, documenting, and reporting your reasonable concern. Because infants are at the highest risk of dying from abuse, we need to spend a moment on abusive head trauma. You may know it by the older name, shaken baby syndrome. The medical field now prefers the term abusive head trauma, or AHT, because the injury can come not only from shaking, but also from slamming or throwing a young child. AHT occurs almost entirely in children under the age of 2, and most often in babies under 18 months, because their neck muscles are weak and their heads are large and heavy relative to their bodies. When an infant is shaken hard, the brain moves inside the skull. In just a few seconds, brain tissue can tear, blood vessels can rupture, and the retina at the back of the eye can detach. There is no safe amount of shaking a baby. The consequences are devastating and often permanent. Brain damage, developmental delays, intellectual and physical disabilities, blindness, seizures, coma, and death. Warning signs that a baby may have been injured include extreme irritability, poor feeding, vomiting, trouble breathing, seizures, a glassy-eyed or fixed gaze, and being unable to wake from sleep. If you ever see these signs, treat it as a medical emergency and call 911. Prevention is something you can teach families directly. The leading trigger for shaking is a caregiver's frustration with a crying baby. Help parents understand that crying is normal and that it is always okay to put a baby down safely in the crib and step away for a few minutes, and that they should never shake or toss an infant, even in play. It helps to understand why abuse happens, not to excuse it, but because understanding points us toward prevention. Common risk factors include a limited understanding of child development that leads to unrealistic expectations. For example, expecting a 2-year-old to sit still and never make a mess. Add social isolation, unmet emotional needs, family crises, financial stress, substance use, and a caregiver's own experience of harsh parenting, and the risk climbs. The CDC notes that rates of abuse and neglect are about 5 times higher for children in families with low socioeconomic status, largely because poverty piles stress onto families. The encouraging news is that abuse and neglect are preventable. Protective factors include parent education, counseling, and concrete supports like help finding work or meeting basic needs. We can teach families decision-making and stress coping skills and connect them to a support system so they are not isolated. The single strongest protection, in the CDC words, is safe, stable, and nurturing relationships and environments. As a child care professional, you help build exactly that, both for the child in your room and for the family you partner with. Even after a child is safe, the effects of abuse and neglect can show up in the classroom in ways that are easy to misread. The NAUIC article on trauma-sensitive classrooms explains the brain science clearly. Roughly 1 in 4 children experiences a trauma before the age of 4, and most early trauma happens at home at the hands of the people the child depends on most. When a child lives with chronic fear, the brain's stress response, the fight, freeze, or flee system stays switched on. The part of the brain that handles emotion, the amygdala, gets overused and overdeveloped, while the part that puts a potential threat in context, the hippocampus, gets underused and underdeveloped. The practical result is a child who reacts as if in danger even when nothing is wrong. A toy dropping loudly or another child pretending to cry can trigger a full stress response. This is why trauma can look like aggression in one child and complete withdrawal in another. The article describes Alex, who screams and destroys materials, and Kiera, who silently disassociates and is mistaken for a daydreamer. Both behaviors are symptoms of trauma, not defiance or laziness. Trauma can also delay language, since some children mainly hear commands at home and can interfere with the imaginative play through which children normally work things out. Seeing these behaviors as signals rather than misbehavior changes how we respond. So what do we actually do? The NAYC article offers concrete, doable strategies, and the theme running through all of them is safety, predictability, and trusting relationships. Keep daily routines consistent because stability teaches a child that the world can be safe. A picture schedule on a wall helps children know the order of the day. When something out of the ordinary is coming, like a visitor, tell children in advance and let them ask questions so the unexpected does not trigger a stress response. Offer real choices within the day, such as where to sit at lunch, because trauma often involves a loss of control and choices give it back in small, manageable ways. Anticipate the hard moments. For a child who sometimes wakes up at home alone, nap time can be frightening, so sitting nearby and reassuring them you will stay can make all the difference. Teach simple self-regulation tools like a daily breathing ritual. And be warm and affectionate, but take your cue from the child. The article makes a key point. Not every strategy works for every child. A reassuring pat on the back may calm one child and cause another, like Kiera, to retreat further. Above all, stay calm and offer empathy when a child melts down, because a predictable, caring adult is what helps the brain rewire towards safety. And remember, if anything you observe makes you suspect abuse or neglect, trauma-sensitive care does not replace your duty to report. You do both. Now, the part of this content that is not optional, in Texas, reporting suspected child abuse or neglect is mandatory for everyone under Section 261.101 of the Texas Family Code. You do not have to prove anything. A reasonable suspicion is enough, and you may report what a child or another person has told you. Because you are a professional who works with children, the law holds you to a higher standard than the general public. You must make your report within 24 hours of the moment you first suspect abuse or neglect. That deadline used to be 48 hours. Senate Bill 571 shortened it to 24, effective in September of 2025. Mark that change because it is recent. Here is the point professionals most often get wrong. You cannot delegate this responsibility. Telling your director and assuming they will handle it does not satisfy the law. The duty is personal. You report. You can and should also notify your director and your licensing representative, but that is in addition to your own report, not instead of it. A few more essentials. As of September 1st, 2023, the Department of Family and Protective Services can no longer take anonymous reports. So you must give your name and a phone number when you call. Your name is kept confidential by law. Only local or state law enforcement can take an anonymous report. And the law protects you. When you report in good faith, you're immune from civil or criminal liability. Failing to report, on the other hand, is itself a criminal offense. The law removes every excuse not to act. Let's make reporting concrete. For a non-emergency, call the Texas Abuse Hotline at 1-800-252-5400. It is staffed 24 hours a day, 7 days a week. You can also file a non-emergency report online at txabusehotline.org, and online reports receive a response within 24 hours. If a child is in immediate danger, do not use the hotline or wait. Call 911. When you report, follow 4 steps. First, call the hotline and write down the name of the person you spoke with, the date and time, and what you reported. Second, notify your child care licensing representative that you have made the report. Third, document your observations in writing as soon as you can. Stick to objective facts, what you saw, when you saw it, and the child's exact words if the child disclosed something. A second staff member can witness and confirm your written notes, and you keep those notes for your own records and your licensing file. One important note, the department does not accept reports by email, and it does not accept photos, video, or audio files. Make your report by phone or through the online hotline and keep your documentation for yourself. Fourth, if you believe a child is in danger when leaving with a parent, understand that you cannot legally prevent a parent from taking their child. Call law enforcement and let them manage the situation. Your job is to report and document, not to investigate or to intervene physically. Let's apply all of this to 3 quick scenarios. Take a moment with each before I give the response. So, scenario 1, a father repeatedly tosses his 4-month-old high in the air. The baby looks frightened. What do you do? This is a prevention and education moment, not yet a report. Gently talk with the dad about abusive head trauma and why tossing a baby is dangerous. Make sure your program shares information on AHT with every family of an infant and consider covering it in a parent meeting. You are preventing harm before it happens. Scenario 2. A 4-year-old cries when you touch his back and you find multiple bruises and what looks like burns on his arms. What do you do? This is a report. Document what you see with objective notes and dates. Have a second staff member observe and witness your notes, and call the Texas Abuse Hotline within your 24-hour window. If you believe the child is in immediate danger, call 911. Photos are not sent to the department, so rely on your written documentation. Scenario 3. A 12-month-old comes back every Monday with new bruises on the back, legs, and buttocks, and the parent explained it as falling while learning to walk. What do you do? Here's your judgment call. New walkers do bruise, but typically on the shins, knees, and forehead, not the back and buttocks. And a weekly Monday pattern after time away from your care is a red flag. You do not need to be certain. If you have a reasonable suspicion, you report. Document the pattern over time, including whether you see the same kind of marks happen during your hours, and make the call. Let's pull it together. As an early childhood professional, you spend more waking hours with some children than anyone else in their lives, which means you are often the first person positioned to notice that something is wrong. Know the 4 types and their warning signs, and pay attention to patterns over time rather than waiting for a single obvious moment. Remember that you do not need proof. A reasonable suspicion is enough, and in Texas you are required to report within 24 hours You must do it yourself, and you cannot hand it off to your director. Call the Texas Abuse Hotline at 1-800-252-5400 or report online, and call 911 when a child is in immediate danger. Reporting in good faith protects children, and your clear, factual documentation protects you. That is the heart of this content. Stay attentive, respond with care, and follow through.